Here is your stem.
Okay, I am ready.
Okay, so if you've read and understood considering it examination station, please begin.
Good afternoon. I am Dr. Ahmed Awad, one of the surgical doctor. Can I confirm your name and age, please?
I'm Robert, 56 years old.
Hello, report. Today I have been asked to examine your tummy. That
Yes.
include looking and feel your tummy. Also, maybe I need to examine your trunk and chest. Are you okay with this?
Yes.
Okay. Now I will go to. I will be. Do you have any pain right now?
Yes. Too much
Where,
pain.
where, where? Can you show me by your hand?
In
Where
my
is the pain?
tummy, all over tummy. It's too
Oh,
much.
I'm sorry to hear that. Do you want any painkiller for now?
Yes, please.
Okay. I will give him analgesia, and I will start examination of his general examination that include to look if he has central cyanosis and his mouth if he's dehydrated. Also, I will examine his hand and his if there is any cyanosis in his hand or clubbing. Then I will go to the edge of the bed and I will close look to his. Can you expose your tummy and your chest, please?
Yes. Okay.
Okay. Now I will stand in the edge of the bed to see the movement of his respiratory, of his chest wall movement, also his abdomen, if there is any abnormal movement or any swelling, obvious swelling in his abdomen. And also, I will inspect the wound if there is a scar or a drain or colostomy.
Okay.
Then I will
You
ask him to
notice.
cough.
Yes.
Can you
Dressing.
cough, please?
Yes.
Yeah.
Yes.
The patient have a severe pain. Now I want to feel the your tummy. Okay.
Okay.
I will put. Where is the pain?
Yes. Here, all over the tummy.
Okay. Once he is tenderness over his tummy, all over his tummy, this patient have suspicion of botulism. So I will change my examination to other way. That mean I will manage him according to the Ccrisp protocol. That mean I will start with airway. Assess his airway and management of his airway. If the patient airway is patent, I will put an oxygen flow between 12 and 15 liter. I will put the
Okay.
mask over the patient. Then for the breathing, also I will put a pulse oximeter to assess. Also, in the breathing, I will see the respiratory rate, pulse oximeter. Also, I will palpate the trachea if it's central or not. Also, I will assess the chest movement from front three from proximal or middle and lower of his trunk.
Yes.
Then I will auscultate his chest to see if there is a abnormal breathing sound and air entry. Also, I will auscultate the heart sound at the apex and the tricuspid area and pulmonary area and aortic area. Then I will order a chest X-ray for him, chest X-ray and ABG. Also, I will go to see that I will insert the cannula, large board cannula. Also, I will assess his blood pressure, capillary refill in his hand. Also, I will assess he is dehydrated or not. Then I will take a lab CBC, kidney function, electrolyte. Also, I will insert a Foley's and I will see if he's hypotensive. I will give him IV fluid, 20 ml per kg as a bolus. Then I will assess his neck vein if he have a congested neck vein or not. Also, in the D, I will check his mental status. If he is conscious or VBU means if he is alert. Then I will check his blood glucose
Okay.
and if he taking any analgesia post-op.
Yes.
Exposure, I will expose the patient and expose the wound and examine the patient from head to toe examination. Also, I will monitor the urine output for this patient. Also, I will expose to assess his scalp for calf pain or hotness if he have DVT.
Yes.
After that, I will want the chart of this patient. Okay, there is a trending of increase of his body temperature, febrile. Also, his heart rate is increasing, tachycardia. Also, blood pressure is trending down. That means the patient suspicion of sepsis and septic shock. So I finish my examination. I will wash
Okay.
my hand
And you'll thank the patient and you'll ask
Thank
if
you.
patient needs any help in
Okay.
covering.
Okay, thank you. Thank you. Do you want any help to address
No,
you?
that's okay.
Okay,
All
thank
right.
you.
Can you please summarize your examination now?
Today I have been examine this patient who is post-op by day 6 left hemicolectomy.
Yes.
The patient have abdominal pain. By inspection, the patient have a scar in his left lower quadrant of his
Yes.
abdomen. The dressing is dry and there is no discharge, no
No
drain,
soaking. Yes.
no soaking.
Yes.
When I ask the patient to cough, he have a severe abdominal pain. That means suspicion of peritonism. After examination of his tummy, there is a tenderness all over his abdomen. So
Yes.
I start my management assessment and management with the Ccrisp protocol.
Very good.
The airway that I apply oxygen mask 12 liter.
Yes.
Also, I palpate the patient's airway is patent because he is talking to me, and the breathing. I palpate the trachea was central. Also, I auscultate the chest for air entry and added no added air sound. Also, heart sound S1 and S2 is normal. Also, I missed to percuss his chest wall to rule out the pneumothorax.
Okay.
And I miss to examine his back and BR should be examined.
In this one, you should not be examining it or listening to his heart from the back, because
Okay.
it's anastomotic leak. Okay.
Yeah.
You should mention that patient has touch talking. But anyway, were there any swelling in the legs or calves?
Yeah, I examine his lower limb. There is no swelling or tenderness in his scalp.
Okay. What about the patient's vitals? How were the patient's
The
vitals?
patient vitals, there is tachycardia, blood pressure is hypotensive. Also, the patient is febrile. Also,
Yes.
his labs showing white blood cell increasing and
Right.
CRP increasing.
All right. Okay. Can you reassure if ECG was done? And if so, what does it show?
I didn't see the ECG in the file.
Okay.
Or is it? I don't know if in the stem there is a ECG.
Yes, there is.
There is
There is ECG and it shows atrial fibrillation. All right.
okay.
Then, in that case, what would be your main differential diagnosis?
My top differential diagnosis, the abdominal sepsis due to peritoneal anastomotic leak.
Leak. Okay. Yes.
The other differential is
Yes.
the other differential is subdiaphragmatic collection or intestinal obstruction or
Yes.
volvulus or ischemia for ischemia of the
Mesenteric ischemia.
mesenteric ischemia.
Yes, because patient has AF. Right, very good. All right, okay. You mentioned about giving oxygen to the patient, what
Yes.
else? What else, or what other steps would you take in order to manage this patient?
Uh, I I will put pulse oximeter and
Right,
assess
right.
pulse oximeter,
And
also ABG. I will put
yes,
ABG.
yes,
Then I will reassess he again if there's
and
any change.
and the most
Uh, I
important.
I I ask him if he is improving or not with oxygen.
All right, and then you'll
Uh, s-
inform the HDU, and then you'll also request for the
okay,
transfer.
yeah, the patient need, yeah. If not
Needs trans.
responding to the fluid,
No.
okay,
And
I
also,
will
you
ask.
have to insert the central line in for the monitoring, because you can't just stand there and monitor. You need
Okay,
lower staff to, like, one-to-one lower staff to
yeah.
stand there and monitor. And what are the things that you'll be monitoring on in this particular patient?
I will monitor urine output, mental status, and capillary
Yes,
refill.
and urinary output as well.
The Yeah, urine
And
output, yes.
ABGs when you're doing, so you have to
ABG.
monitor, yes,
Yeah,
for everything.
yeah.
What about ultrasound abdomen?
Ultrasound abdomen. Yes, maybe after stabilization, the patient may he need the ultrasound abdomen and CT for his abdomen for
Yes.
preoperative planning because the patient need urgent
A
exploratory
laparotomy.
laparotomy.
Yes.
Yeah.
So what procedure can you offer while you're doing exploratory laparotomy? What
The
more
patient
can,
need Hartmann
yes,
Hartmann
advanced
procedure
procedure?
that
Yes.
open drainage, also to peritoneal, good peritoneal toileting and
Yes.
stoma formation.
Yes. 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 Good. Right. All right. Good. Very good. Thank you.
Yeah.